If I go to the bathroom, it's like I am struggling to finish.
Tell him about the blood in an hour.
All right, ladies and gentlemen. Did I say ladies? Okay, no. Well, gentlemen, this is your talk. Ladies, I know most men only go to the hospital when the ladies push them. So ladies, you can listen in.
Objection, my lord, objection!
Today we're going to talk about something that many men don't even bother about its existence. And because they don't care, just like the spare tire in their cars, nobody cares about it until you need it, or maybe until it's flat. And when you need it, it might be flat.
Error is showing mercy on anyone with prostate cancer. Let it be reversed. Let it be reversed.
Prostate cancers, you don't know where your prostate is. Most of you don't. But imagine that it's something that is just tight right there in the stomach, like underneath in the pelvic area, doing its job without bothering anyone. It's almost like the shape of a walnut. I'm not sure you guys know. Well, you may. Walnut. Abalomo, you know, abalomo is the size of an abalomo. And then it does the job, which is helping with producing the seminal fluid so that you can keep your manhood going. Now, sometimes this little gland becomes problematic, and it's usually when men start to get older. So if you're 50 and above, it's time to really listen in.
Go straight to the point.
This abalomo-shaped stuff suddenly becomes hard like a coconut. So after 50, you start to hear issues about the prostate being enlarged, or worst case scenario, about the prostate cancer.
Doctor, it's hold and hold you. But I am very strong.
Now I know I've got your attention with the cancer bits. Now prostate cancer is a serious disease. Newsflash, is the most common cancer in men. And because it's this common, the onus is on you men, on us men, to try to detect it early. With every cancer, early diagnosis is key. So imagine this prostate gland gets coconut shaped or becomes hard like a coconut. It starts to make things harder for you, even passing urine, or you start to have blood in your urine. These are subtle symptoms that men often overlook.
When I urinate, blood comes out.
It's pain, oh.
And because if you're like me, you wouldn't like going to the hospital. It's not a place you want to go or see your doctors. Men literally run from their doctors.
I wish I know one here, maybe this.
How do you now know how to pick this up? Now, prostate cancer is not solved by just wishing it away. It's not something you sit on and hope that it goes away. It will not. So you need to make out time. Come see your doctor. The doctor does a few tests. He might want to examine you. Many of you have heard about the doctor examining you for the prostate, and maybe that's why you're running away. Come on, you're not going to wish this away. If that needs to be done, just come in. It's the most gentle, perhaps not so pleasant examination, but if that's what it takes to get you going, you better stand. You can stand a minute of being uncomfortable and having a lifetime running flat.
I will never. I would rather walk on hot coal.
So you need to get that examination done. Some blood tests called a prostate-specific enzyme, which would detect if there is something cancerous going on.
Scroll down. If you go, I can't hear.
If these numbers are high, that's the beginning of the solution, because something needs to be done to bring it down. But first step for all men above 50, you do stand a chance. You're at high risk of developing prostate cancer as you get older. Make out time. Come see your doctor if you're having difficulty passing urine, if you're having some blood in your urine, if you're losing weight, and even the very subtle sign like a lower back pain. For no cause at all, it's hurting you at the back. You need to make out time come in. We can walk things through, get you seen, and we can get you fixed before you start to go flat.
You will put your finger inside a title chip anus.
Daddy, calm down.
It will never happen, doctor.
My name is Dr. Giobira. I'm the GP with a special interest in YouTube. Thank you.